You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today, very interesting topic. We're talking about TMJ dysfunction. According to my first guest, that if you have a migraine headaches, sore jaw, clicking, popping, that you may have this problem that can be corrected with a variety of new modern techniques. Well, with us, we have an expert on the topic of TMJ, Dr. Gordon. Dr. Gordon, welcome to the program.
Thank you, Randy.
And
appreciate it.
Pleasure to talk to you. Now, before we get into today's topic, tell me a little bit about your practice. I mean, you do more than just TMJ.
Yeah, we're a full-service general practice dentistry.
Okay.
And we treat children, adults, seniors with wide varying problems. TMJ problems, we do implants, restoration of implants, do orthodontics on kids starting at age 5 or 6 so that we can expand their mouth so they don't become TMJ problems as they get older.
Let's begin. Let's jump right into the TMJ dysfunction. What defines it? I guess it's a problem with the way your teeth are coming together that causes all of these other problems.
Right. It's kind of like if you walk with a pebble in your shoe, it throws your gait off. Well, if your bite isn't correct, which is the way the teeth fit together, then the muscles cannot relax.
So the muscles right here.
Yeah.
The TMJ is where? Right about here?
The
Where is
TMJ is the joint right in front of your ear.
in front of your ear.
Right.
Okay.
And the muscles that go across that joint to your skull to hold the jaw into place. It's like a socket. People call it TMJ problems. Well, the TMJ is like a NJ or KJ, a knee joint. They're all joints.
So it's a joint.
It's a joint.
So it's your jaw joint.
Jaw joint, correct.
And if that's off,
if the teeth are off so that the condyle of the mandible, which is the part of the mandible that's in the jaw, if it doesn't seat properly, then you can have problems with the disc that protects it and the muscles that support it.
okay. And you see transformations. I mean, people that have had migraine headaches for years, neck pain, things like that, those things go away. Is that true?
That is true. As fast as a week's time.
So this discipline of dentistry is what? Neuromuscular dentistry?
Neuromuscular dentistry, yes. We're going to use electrodes like you stick on your tissue, and the lead wires are run to a computer program that tells us when the muscle is relaxed. And we can relax the muscle almost down to zero with a TENS unit. And a TENS unit is a unit that's transcutaneous electroneural stimulation. So every second and a half it pulses the muscle and causes the muscle to contract. If I were to do that to my bicep, my bicep would contract just like that, and the muscles contract every second and a half. And in the second and a half after it's pulsed, it will relax. So you pulse it, it contracts, and then it relaxes. You pulse it again and relax. And where that muscle relaxes to, that's its resting length.
So then you have to make the mouth or the bite.
The jaw will pulse close like.
So you build up around the mouth to match this place that's comfortable.
That's comfortable, yeah. It will always.
And then the pain goes away.
The pain will go away, yes.
Let's go over the symptoms, by the way. Okay, so somebody watching this, obviously if you wake up with a sore jaw, you have a problem.
You have a problem because you've probably been clenching. Clenching, grinding teeth like this, sitting there fiddling around like that, sore teeth, sore jaw muscles, inability to chew without having pain, popping and clicking.
There's a lot of people, by the way, knowing that you were going to come on the program, I talked to some people and they say, yeah, I've got a little popping, I've got clicking, this and that, husband, wife has popping and clicking. But you say they're, and I'm paraphrasing you, but it's kind of like they're headed for disaster. That means if you do nothing.
If you do nothing, it can get worse.
It gets worse. How so? I mean, be specific. Help me understand why they need to do something.
Okay, your jaw joint is like your fist like this. And like it's a joint, all of its kind in the body. All the rest of the joints have cartilage that's bound down to the bone itself. It has an opposing bone that has cartilage bound down.
Okay.
And then it has a sac around it with fluid in there so that you can rub. And if you chip that cartilage that's around there, then it's like the football players have to go in to have their knee scoped or something like that.
Okay.
Well, in the temporomandibular joint, that piece of cartilage is just in there by itself. And on the front part of the cartilage, it's attached to the muscle that opens your mouth. The back part of the cartilage is attached to the backside by a ligament. so that as you open and close your mouth like that, that piece of cartilage slides forward and back. And when you click, when you go back, the piece of cartilage stays in the front.
Okay.
So the pop occurs when you move the jaw forward, and it pops into place, and then you're able to open wide. And there's a lot of people that get that piece of cartilage hung out front, and they can't get their mouth
But
open.
does that also create headaches or tension or anxiety or neck pain?
When I unlock a joint, they'll get hung out, the piece of cartilage will get hung forward, and they come in there, they say, that's all I can open it. Well, if I put the TMJ unit on them, it will relax the muscles enough to allow the jaw to drop down, because when that gets hung out front, the muscles spasm up and close shut, keeping that piece of cartilage from coming back. And we tend them for a day or two, and they come back in, and I can manipulate it, and they'll go back
So they
into
feel
place.
better. You're saying that by pushing on the teeth and rubbing the teeth, that you could end up losing your teeth.
That's correct, yes.
Why? I mean, what? I thought
Well-
pressure was good on the teeth.
Well, the pressure you chew with is good, but this is an abnormal pressure, and that's
Okay.
You don't even have to put pressure on. It's just like sandpaper.
I mean, nobody wants to lose their teeth. Are you saying that by grinding, it causes tooth loss?
Eventually, yes. And some people grind their teeth to the point, if they have periodontal disease, they'll rock the tooth right out of the bone.
Is that right?
There are times that you can just reach in and pluck the tooth out once it's anesthetized.
Okay, now, and for people just tuning in, we're talking about how migraine headaches, neck pain, tension, anxiety may be caused because of a TMJ dysfunction.
Correct.
Because your mouth is not comfortable in the position it is in.
That's right.
Is that right?
Where the teeth are positioned.
And especially while you're asleep. So when you're sleeping, that's where the grinding goes on. Because you say that a lot of patients come to you and say, I'm not a grinder.
Right.
But you could tell. It causes tooth loss, things like that. So and by the way, you were also a patient.
I was a patient.
Tell me about that.
From the time I was 10 years old, I suffered from severe headaches. And when I was 16, I was out in the backyard playing basketball with my friends. And I got this strange feeling, and I couldn't talk and say what I wanted to talk. My eyes were blurred and everything. And I was scared. It scared me. I was playing with my friends. And I just
Interesting.
walked off, went in the house, and got in bed. But when I was in dental school, I was put in the hospital my junior year because
Why?
they thought I had a brain tumor.
Why is that?
Because I went to the doctor that was teaching the physical diagnosis class to the dental students, went to his office, and I was on my way to the gym that night. My wife dropped me off, and I was at the Olympic Club in San Francisco. And they have this probably 20-foot stairs, marble stairs up to the front door. I got about 3/4 of the way up, and I said, I just can't go in there.
Why?
Up to that point in time, anytime I felt bad, I always went to the gym to work out, sit in a steam bath or the whirlpool. I just had the headache too bad, and so I went over to the doctor.
So your headaches were bad. I mean, all through
dental
early
school.
life, even
Yeah.
dental school.
Yeah, all the time.
Okay.
So I went to see the doctor. He says, you're not going anywhere. I'm putting you in the hospital. I said, why? He says, well, your optic disc is obliterated. It was bleeding in there.
Interesting.
And it was all caused from
TMJ.
TMJ.
So how did you find out? That's the part I'm missing. How did you make the connection that you had a problem that was causing these headaches that they thought were caused by a tumor?
I was connected in it after I found out about the TMJ.
Okay.
So I continued to follow these studies
After dental school.
And I was in a class in Atlanta, Georgia, probably in the late 70s, and I was sitting there watching the instructor flash patients on the board, and he showed a patient up there had every symptom that I had.
Okay.
And then he was put on the machine. He got his correct bite.
This neuromuscular dentistry
The
machine.
neuromuscular machine.
Okay.
And all of his symptoms disappeared. So the guy sitting next to me, I said, would you take me back in and work me up the way he was just worked up? So he worked me up.
Okay.
I said, I've got a friend in Dallas who has the neuromuscular equipment. And I went to him, and he was an orthodontist. So
you went to Dallas.
I went back to Dallas. I was practicing in Irving, which is just outside Dallas at that time. And
So they corrected your bite. They found you had a problem with your bite.
correct.
They fixed it. How?
With a splint.
Okay.
We made a splint in the lab that day, and I went home wearing an orthotic. The orthotic is worn 24 hours a day. Takes about 3 or 4 days before you get used to have that extra plastic in your mouth. But once the muscles relax, it was hard to get along without the piece of plastic in the mouth. So we use orthodontics in order to pull the teeth into the place that has the where the orthotic used to be.
And how soon did you start feeling better?
Probably 2 weeks.
Really?
Yeah, and I didn't have, after that point, I never had another migraine headache.
Okay, now you were a guy actually, let me get, so you had, your whole life was revolving around these headaches. Is that
Yes,
right?
that's correct.
I mean,
yeah.
you were checked into hospitals?
Hospitals.
Okay. So they fixed your bite because you have nerves right here, right?
Correct,
TMJ.
yes, right.
They're connected to the head. You had headaches. Fix that, headaches are gone.
That's correct.
So you what, became committed now?
Well,
I'm going to teach other people how to do this. I'm going to do this for my patients.
I'm going to do that for my patients, yeah. And
interesting.
now,
Good for you.
I have not heard anybody else say that migraines are cured by that, but I know that most of the patients, almost all the patients I have that are migraine headache patients, do get better from their migraines.
They do get. Okay, good.
Yeah. Now, do they disappear 100% right off the bat? I can't tell you.
Have you ever had a patient, by the way, you could share these stories if they're true. Have you ever had a patient that it's 100% went away?
Yes.
You have?
I've had, yes. And in fact, I just had one that was referred to me by an oral surgeon. I'm in a study club in San Antonio with general practitioners and specialists. And the study club, before I got in there, were sending all their TMJ patients, or the patients they thought were TMJ patients, to the oral surgeon thinking they need to have surgery.
Okay.
And he was glad to see me come in there, but he's my best referral source now.
So the oral surgeon sends you people?
Yeah, because they don't need surgery.
So using my hand, I mean, you're basically aligning the jaw in a way through either orthodontics, a splint, or through crown and bridge or whatever, and you're making a comfortable bite that
Correct.
these people weren't even aware of. Their muscles relax, the nerves relax, migraine headaches potentially could go away.
Right.
Tension, anxiety, things. I'm calling it anxiety, but I guess if you're grinding your teeth while you're sleeping, you're probably not getting a great night's sleep.
You don't get a good night's sleep either.
So this can be fixed. I should also mention, I interviewed Dr. Gore. We're talking about TMJ, maybe the cause of your migraine headaches, soreness. Also, you could lose your teeth by grinding, and it can be easily fixed in many cases. But I interviewed you on my iTunes. We have a podcast. You could search Lynn Gordon, or you could search Randy Alvarez, and on my iTunes, we do kind of a uncensored. Because I said, some of the things that we talk about that on that podcast, we're not going to have you say on the show, because you're very aggressive on this iTunes. So I would suggest people go to iTunes and listen to your interview there about this. But okay, so take me through the process, because what are the approaches to helping people with this bite problem that are grinding, their teeth are short, popping, clicking? What are the different techniques you can use?
There are different ways that people are using. In my opinion, there's only one way to correct it, and that's use with the neuromuscular equipment.
Okay.
Because we can prove...
That's computer equipment.
That's a computer equipment where we can put the bite, which is the point on each tooth, within 1/10 of 1 millimeter of where it's supposed to be according to the tracking on the monitor. People say 1/10 of 1 millimeter. Well, you can't even do that with the sharpest pencil.
Okay.
Well, the reason why we're able to do that is because we have computers now where that can be a millimeter, and we can divide that up easily in 1/10. So we put the screen on and change the gains on the computer so that we can measure that, and we can put the bite within 1/10.
So once it's measured, and then you have a feel for what the bite is, what do you do, like a wax up models?
We have models, but we put a soft acrylic in there, and we say, okay, close, move left, move right, and we're able to tell the patient how to move into that one place where the beats of the jaw come together.
Okay. So you treat it with, so once you find that, you do an orthotic that they could sleep with.
They sleep with that, eat with it.
Eat with it.
Kiss with it. It's with them 24 hours a day.
Does it show? I mean, can you see it?
No, because the funny thing is, once you put that in the patient's mouth, their muscles can relax. You think your jaw's like this, your mouth's going to continue to be like that. But their mouth will begin to relax and cover that.
Okay, let me ask you a question here. As I'm sitting here, I have flat feet, okay? I can stand, I can run, I can do everything else, but I was explained by a podiatrist, it's true, if I stand in one place for a long time, my feet hurt. Walking, they don't hurt. He says because you have to tense up to create an arch, okay? and so your feet hurt because the muscles are stressed. Is it that same way with the jaw? That means if your jaw's out of line, you have to kind of tense up just to make it comfortable? Is there any truth to that?
If it's out of line, I don't think you can tense up.
Okay.
You got to relax in order to.
Right, but what I mean is for people that have soreness, sore jaw or migraine headaches, are you saying that there's a tension created?
There's a tension created that causes that pain.
That's what I mean. Right?
Yes.
So
yes.
you're creating some sort of a tension there.
Correct.
That could be corrected. How many people suffer from TMJ problems?
I have an anecdotal thing
Okay,
about
tell me.
that tension.
Tell me.
I had this lady that was 63, 65 years of age in my practice in Dallas that came to me that was referred because she was a pain patient. And so I put her on the computer that first time, and she went to take the bite. She went back to her office after her appointment in his office, and they said, "What'd you do to your face? What did he do to you?" She didn't want, you know, how when people ask you a question like that, you don't want to really just blurt out. You want to say, "What do you mean?
Okay.
What's the matter?" And they say, "Well, you look like about 10 or 15 years younger."
Okay.
She said, "Really?" I said, "Yeah, all the muscles of your face are relaxed." And she told me when she came back this episode, and over the next 3 or 4 days, her face went gradually back to the way it was when she first came in until she got the orthotic again. And
Is
then
that right?
the orthotic we just place in the mouth, and the muscles just relax the same way.
So you can see physical changes when you fix the bite.
That's right.
Okay.
Facial changes.
And let's talk about, okay, so people could at home, I like, these interviews, by the way, people need to know are real. I'm not siding with you here. I'm just asking the questions. But let's help people self-diagnose. Okay, so if you've had orthodontics where they pulled a bunch of teeth, or 3 or 4 teeth,
right.
and you have migraine headaches, chances are that orthodontics, there may be a connection with that you have a bite problem.
That's correct.
So if you have short teeth,
Absolutely.
Okay.
There's a reason why they have the short teeth. Their muscles are not comfortable.
all right, and clicking,
The clicking isn't necessarily from the tension in the muscles. The muscles become tense once the clicking starts because the jaw can't relax to go back where it's supposed to go back.
all right, and if your general dentist has told you you're a grinder, because I talked to a general dentist, he says, I tell people they're grinders probably every single day, and they just dismiss it like it's no big deal. They just want to get their cleaning and go home.
Right, yeah.
Okay? So
Well-
what do you say to the person that's been told you're a grinder?
Those people may not have had an episode yet where they had pain. Just because you grind your teeth doesn't mean you have pain. I see a lot of people who grind their teeth that don't really have pain. I
Right.
just call that attention to them. I say, you might want to have an orthotic in your mouth just to keep you from grinding, if for no other reason, maybe not for pain. But I do
But why is the question? Why would they? If they have no pain, why do the orthotic?
to preserve the tooth structure so they don't have a breakdown, so they don't wind up having to have implants or
Okay.
full dentures as they reach 50 or 60, 70 years of age.
All right.
And with your natural teeth, you eat foods that's healthy for you. And with dentures, all you have is mush because
All right.
a denture cannot chew raw broccoli, raw cauliflower, carrots, and stuff like that without, get it ground up. I'd hate to be inside of somebody's stomach who wore a denture and tries to eat healthy foods.
Now the NFL, the National Football League, that they're now big on these correcting the bites.
Correct.
And they say it
Mouthpiece.
makes mouthpieces that make the player stronger. Is this the same kind of thing we're talking about?
That's correct. Before the computer program came out, they were using kinesiology, where you stick your arm out like that and press it down. They'd put sugar in your mouth, show that sugar's bad for you because you didn't have the strength.
I've had that done to me, by the way, where they put a big cardboard thing in my mouth and I was stronger.
Yeah, and when they put the bite in the mouth, they can tell you, you may put one up like this. Well, it's not going to make you stronger if it's that wide open, unless your bite's that far off. But when you get down into your narrow range where you're stronger, you'll test stronger. And that's what a lot of dentists use to make their splints with. And there's still a lot of them
But
doing
the
that now.
NFL, the NFL,
they ran tests on wrestlers, offensive and defensive guards, the grunt men.
Yeah.
When their teeth are, if you lift down and pick up a heavy set of barbells, I'll guarantee you're sitting there with your teeth clenched together.
Okay.
And if your teeth are not in the right place, it can actually weaken and keep you from
So,
listening.
are there scientific studies that are saying that with these NFL players, when you give them the right mouth guard, they're stronger?
Yes, there are. A lot of them. And the company Under Armour is putting out mouthpieces for people. They realize that they're putting out mouthpieces, generic mouthpieces that for kids that are playing high school football that will increase their strength.
Is that right?
That's right, yeah.
Is that right? So it's the same technology.
Same thing, yeah. It's just that we're more precise in putting it in the right place.
We're out of time. Okay, so a recap. Somebody has popping, clicking, soreness. They wake up with a sore jaw. Maybe their spouse says, hey, when you're asleep, you're grinding your teeth. Because if you grind your teeth, like you say, you make them short. You can cause tooth loss, et cetera. But especially if you have migraine headaches, your approach is what? Okay, so as a recap.
My approach is you come to my office and we take models of your mouth. We take an x-ray of the side of your head. And we have that x-ray traced by a company in Minnesota that tells you which way you grew. And from that, we use that in the orthodontic part. If we're going to recapture your bite by using orthodontics,
okay,
we know which way to move the upper jaw or the lower jaw. If you don't do that, if you don't do the orthodontics, then we use full mouth reconstructive crown and bridge, which is nice.
Kind of building up the mouth.
Building up the mouth. In other words, people may have, instead of their teeth being naturally that long, their teeth are about that long, but once the, like I said before, once the muscles are relaxed, you can't tell they have long teeth.
All right.
Unless you just sit around like this and they,
okay,
you know, look like jackass eating briars or something
yeah,
like that.
Yeah.
So we use that, or we use a neuromuscular splint, and they can stay in the neuromuscular splint.
That's
now,
24 hours a day?
24 hours a day.
Okay.
Now the neuromuscular splint, because it's made out of plastic, they can destroy that by dropping it in the sink or biting something hard like a popcorn kernel. It'll start chipping off. So we can make a metal base that covers the bottom teeth and put porcelain on the top, similar to the way you make a crown. Put porcelain on the metal,
okay,
and build it up in the same thing so it doesn't disappear.
Okay. Who should for sure seek treatment? I mean, somebody at home, they have some sort of symptoms. Who should see treatment?
I'd say anybody that's bothered by headaches should see treatment unless they enjoy having a headache.
I mean, it's worth a try.
It's
so
worth
they
a
go in for a consult.
They go in for
based on your machines. Can you tell them, I think that that there's a connection between your bite?
Definitely, yes.
But will you ever say, no, you have a pretty good bite, I don't see the connection?
There are times when that particular patient that has good teeth, no wear facets, and the bite looks good, without doing the orthodontic x-ray, I would never say it unless I saw the x-ray too, because the x-ray will show things that you can't see visually on the patient.
Okay. Okay, so if they have migraines or they have headaches, unexplained, go and get a consult.
We treat everybody the same starting off, so I can get all the information I can get before I lay myself on the line to what I'm going to do.
All right. And this is scientific dentistry. I mean, you're part of a study club where, I mean, is it focused on TMJ, by the way?
Yeah, it's North American Neuromuscular Study Club. I was a partner in that for 3, 4, 5 years of dentists all over the United States who did orthodontics, who did TMJ, and had the neuromuscular machine. That was the three things that tied us together.
And you've studied under the guys that kind of pioneered this whole philosophy and approach. Is that
correct.
right?
That's right, yeah. The neuromuscular company is in Seattle, Washington.
Okay.
And Bernie Jankelson was the original pioneer, and his son Bob has taken over the company now, and he's running it, and it's just getting better and better.
I had a guy say to me one time, he said, Randy, the future, all dentists will be neuromuscular dentists.
They have to.
They won't be able to look the other way with this science.
They can't. I don't see how they do it now, because the first time I saw that lectured was in San Antonio at the dental school 25 years ago. And that was before I was restored. And at that time, it just clicked to me like that. It's just like, well, why isn't that being taught all over the place, you know? But it's not.
Interesting.
And you go to people at the dental school who are teaching, oh, that's just too much baloney. They just got so much time to teach you.
Yeah.
Enough to keep from killing people or damaging people.
All right.
They don't have time to teach you the other. But they also don't give any postgraduate courses.
Or very little
on a regular basis.
Okay, let's say now people are just tuning in. We're talking to Dr. Lynn Gordon. He had headaches in and out of the hospital. Is that right? I mean, that's true. They thought you had a tumor.
3 times.
They had to figure out what's causing this guy's headaches.
Right.
You were at a lecture. You saw a dentist. This is continuing education. Saw a dentist talking about a patient's symptoms. They were all yours. you got you went in, you got a neuromuscular dentist looked at you, corrected your bite, headaches went away, and you haven't had headaches in how many years?
I haven't had a migraine headache in 25 or 30
So
years.
the first half of your life, most of it was headaches.
Headaches. Now, I don't have it, maybe 2 regular headaches now.
Okay.
And that's generally because I'm tired or done something to strain my neck or something like that, or my shoulders.
So go in, get examined, and especially if you've been told clicking, or if you know you have clicking, popping, and you grind your teeth, go in and look for a doctor that focuses on TMJ.
That's right. That's correct. Yeah. And there are not very many out there.
So ask them. And you've spent 30 years.
Yes.
Is it exciting to you, by the way?
It's exciting when I have somebody come in and say, I feel so good. And they come in and tell my staff, who also gives them a big hug.
They say, I feel good after the treatment. You told me, you said, Randy, you know, I do all types of dentistry, but if I had it my way, all I would do all day long is work with people with TMJ problems.
That's right, yeah. It's much more exciting about seeing people smile, you know, and there's no needles involved generally. And most people don't go to the dentist because they fear what's going on.
And we're talking about getting people out of pain.
Yeah, we want to get them out of pain.
All right. Well, I want to thank you for coming on the program. Very interesting. Very interesting.
Appreciate it.
If you'd like to see this interview again, just put in TMJ Dr. Gordon on my website at wellnesshour.com. Also, go to iTunes if you want to hear the uncensored version of my interview with Dr. Gordon. Go to iTunes, put in Randy Alvarez or put in Lynn Gordon. You'll find him on iTunes. Download it because bad orthodontics, maybe they took out too many teeth, whatever, car accident, something that threw their jaw off could be causing their migraine headaches.
That's correct.
Things like that. I want to thank you. Great stuff. Great info.
Well, thank you.
Thanks again. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, go online on our website, wellnesshour.com, and just put in Dr. Gordon. For now, I wish you good health.